Hi everybody, we are here in the AAFE Training Center and today we have a patient who is here for Botox. She was treated in another practice about 3 months ago and unfortunately experienced some pretty significant lid ptosis following her treatment. So what that is can happen for a couple of different reasons, but generally it's when we're treating the glabella, more specifically the corrugator muscle, and what happens is that neurotoxin migrates downward and then affects the opening of our eyelid. And so then the result is lid ptosis. It can happen for a couple of different reasons, either too high of a dose, poor technique. We in the AAFE always treat and teach to block off the orbital rim, so we're preventing product from migrating downward. And so that's what we're going to do to prevent it. And then patient education is so incredibly important, making sure that they know once they leave the practice, the office, there's no touching the face for 4 hours, no hats, no headbands, nothing that could migrate the product down in the wrong direction. We generally say no exercise for the day of the procedure, just to make sure that, they're not elevating their body temperature and potentially accidentally migrating it as well. So excellent technique, appropriate doses, and good patient education will all help minimize complications that you have following neurotoxin procedures. All right, so we're going to go ahead and treat these following 3 areas: the frontalis, the glabella, and bilateral crow's feet. She has a really interesting anatomical, most frontalis bifurcates, so it splits, but it generally does it different places on people's head. Sometimes it's in their hairline, sometimes it's lower on the forehead. Can you raise your eyebrows for us? And you can see here, it's a really nice visual of that bifurcation in the frontalis. So just something cool I thought I'd point out. And we're gonna go ahead and get started. So treatment of the frontalis, dosing and location of injections is really important. The frontalis is the only muscle that keeps our eyebrows in place. And so if we give too much in terms of dose or our injection points are too low, you risk compromising the positioning of their eyebrows. I will say that this patient has deep set eyes, and patients who have deeper set eyes generally are able to tolerate more in terms of dosing. Even if you had placed a little bit further down on the frontalis, the orbital rim almost acts as a barrier to prevent the brow from dropping. So not necessarily a concern with her, but something you must keep in mind. Of course, always evaluating everybody's individual anatomy. You doing okay? Okay. Now into the glabella. So we're first treating the procerus, and now we're going to work our way to the corrugator. So again, this is where she likely had an issue last time. So I'm using my pointer finger to block her orbital rim and being incredibly mindful of my depth of the needle, that we're not going too deep. And then when I switch sides, I'm now using my thumb to block her orbital rim. And always wiping up and away. We never want to wipe downwards and potentially move that product anywhere. All right, look away from me just a little bit. So you can see she's pretty vascular around the eye. Most people are. So obviously we'll do our best to avoid any vessels we can see. Of course, there's a lot that we can't see, so we do the absolute best that we can. Okay, and look towards me, please. Cheesy, relax. And that's all that we have for today. Of course, again, wiping all of your markings up and away.